I guess we're going to get started either way. So if you can hear me and not see me, well, that's probably better for all of you anyway. So, hello everyone.
Step over here because then you're in the view of the camera. Right?
Where's the camera?
That's over there.
Oh, the camera is over there. Hello. What? Perfect. So, it's been a long week. Thank you everyone for joining or listening, and I'm not going to give you much of a choice on the latter. So, this is why no one gives me a microphone. I just wanted to, I don't know, Anya, if you wanted to start. You just want to start. Perfect. So yeah, we're going to talk about the student pitches and the student projects that happened and the judging. I'm Gino Canessa. I'm joined here by my esteemed panel with...
I'm Miriam from FHIR.
And I'm James.
James from Smile. It needs no introduction, yes. So we're going to very quickly each, we did this in order to be democratic. I was judge number 1, so I'm going to discuss the elevator pitch from team 1, and then judge 2, team 2, and judge 3, team 3. So go there before we get to the winner. I'm discussing team 1. They had a project called Mommy Notes. They're a team here locally from Amsterdam, so the home team, if you will. And they did a patient-centered mobile app for women's health, specifically targeting women with lower health literacy and how to get that information and get it into an actual consumable format for them. Things like your heart rate was higher at your last check-in exam, and what that means towards your pregnancy and types of things that you can do to address it, all these kinds of things. It was a very interesting app. Using FHIR, pulling data, simplified notes, things that you can actually relate to as a human being. I really liked a lot of the things. It's talking about both women's health, which I think, as we've discussed several times, is a pretty underserved area in healthcare right now, and historically. And then also it touches on a lot of these kind of what we don't consider normal practice of medicine. That these are the social determinants, the social impacts, all these different things that are not clinical healthcare in the way we consider it often. And so it was a fantastic project. They did a fantastic job presenting it. And yeah, I just wanted to, I don't know what else I need to discuss, but they did a fantastic job, and that was team 1. And I have to be quick, so.
No, I'm next.
Yes, but you have a mic.
Oh, yeah, thanks. So team 2 was a team from the University of Applied Sciences in Austria. And they had a FHIR project called FHIRlosophy, where they predicted the length of stay for an ICU. They focused on a specific disease there, and you could fill in the metrics and then, well, click on the button of the app and you would see what the length of stay was. What we did appreciate as jury was that they did a lot of scientific research to find out what the correct metrics were that they could use for this. And they trained a model to make sure that they could get that out. And they actually did lots of work in comparing models as well, so they could choose the best one with the best outcomes. We also think that this would be a very good added value. There's a couple of future things that they still would implement in that app, but then it could really help patients, their family, and also doctors with the length of stay, and specifically the patients and the family, to know why this length of stay is the predicted one. We liked also how the team worked together and were flexible because they had to adjust along the way because of the challenges they faced. So yeah, we really loved that.
All right, and Team 3 created an app called CareFHIR. Team 3 are from the University of Applied Sciences in Upper Austria as well. With their app, we really, the judges really appreciated the completeness of the solution. It was an app for self-management of panic attacks, and the idea being that if you were having a panic attack, you could click a little button in it, and it would sort of register the severity of it and create a FHIR resource on a FHIR server that was well-coded to store sort of that information so that you could retrieve it later. We really liked about this app that, as I say, it was a well sort of self-contained, complete complete solution to the problem. We actually couldn't think of much they would need to add to it for it to be ready to start being used, but they had a whole bunch of plans for the future as well, which we thought was really cool. They also had t-shirts made, which I thought was really neat. So with that said, is this working? The winning team, drum roll please, everyone. Oh no, oh no. There we go, hey, there we go, ComFire. Congratulations, Team 3. Oh my goodness.
Anja, please come here.
Yes.
So all this thanks to Anja, who organized the student track as well. So thank you so much.
There you go, and awards, we have the whole thing.
I think we can sit down.
I think, oh. Oh, yes. Yes, all of us and then one of the team. Yes. I will be down. There you go. There? Yes.
Do you want to take a picture?
So we have, that's for you. We have 2 mics? It's working? Okay, ja, dann nimmt, wo stehen wir?
Okay. Yeah, hello everyone. We are really excited to be here and thank you for the opportunity that we can present a project now in front of you all. Okay, so first of all, I want to introduce us. So we are Alina, Isla, Laura, and Julia. We all study medical and bioinformatics in the University of Applied Sciences in Upper Austria. And we are now in the first semester of a bachelor's degree. So what does our app do? A lot of people struggle with panic attacks. They feel afraid, confused, and helpless. Our app helps in that moment. The user can open the app ComFire and log the panic attack and use tools to calm down. These tools include meditation exercise and the option to call a trusted person for help. This can make a big difference during or after a panic attack.
So ComFire uses 2 main resources. The first one is the patient resource, which is used to store basic patient data, for example, first name, second name, and the birthday. The second resource is the observation one, which we use to document the panic attack. Here we use the fields status, code, subject, effective, and component. So now we're going to talk about the main role of FHIR in our application. So after experiencing a panic attack, the user enters trigger, duration, and severity. And ComFire then takes the first name, second name, birthday, and gets the right patient ID from the FHIR server. After that, it creates an observation with the with the ID and post it back on the server. That's how we make sure that the panic attack is stored in a structured format and ready to be shared with healthcare provider.
So, having talked about the theoretical use of it, let's have a quick look at our result.
Is this welcome screen. Here, I can enter my first name, last name, and birth date. This information is used to obtain the patient ID from the FHIR server. I tap Login to get started. Now I'm on the home screen. The app welcomes me back in a friendly way to create a sense of calm and safety. Let's imagine I just experienced a panic attack. I go to the Panic tab, where I can log the event. I choose the time and date, enter the duration, for example, 10 minutes, and the trigger, like public speaking. Then I adjust the severity using the slider and tap Save. This creates a structured FHIR observation that can later be shared with a healthcare provider. If I'm still feeling overwhelmed, I can go to the Meditation tab. Here, I can choose between a female or male voice and select from calming, grounding, or soothing exercises.
Welcome. If you're finding yourself in a difficult situation right now, that's okay.
These audio tools are designed to help me regulate my emotions during or after an attack. In the Notifications tab, I can select a trusted contact to call for help. If I haven't given permission yet, the app reminds me to enable contact access in the settings. Finally, if I want to log out, I can tap the Log Out button in the bottom right corner. If I don't log out, I'll stay signed in and land directly on the home screen the next time I open the app.
So now you have seen how our app works. Maybe you can scan the QR code and then you will see the observation we created, so you can check if it really works. Yeah, well, you will see the JSON that day. So during our application, we also learned something doing the app. The first thing we learned is how to include and use FHIR in Android Studio. Getting the SDK integrated and thinking about how we structure our resources well was fundamental for the whole project. We also see the importance of using standardized codes. So it's one thing to build an app, it's another one to make it a real healthcare application. And we also spent some time acquiring some basic FHIR knowledge. So it was our first time working with FHIR, and while it was a learning curve, it gave us invaluable experience.
Looking ahead, there are several ways to extend CompFHIR. First, data visualization. This helps to reveal trends and patterns in panic attacks. Second, the generation of structured observation reports, which can be shared with the healthcare provider later on. Third, the identification of medications linked to panic attack triggers, which leads to safer treatment decisions. And last but not least, the application can be extended to more mental health conditions. CompFHIR combines mental health support with medical interoperability. It's more than an app. It's a digital companion that helps us to track, reflect, and feel safe. Thank you all for listening to us, and we also want to thank our mentor, Anna Lynn, and Hal7 for supporting us.
Thank you guys so much. That was fantastic. Yes, all right, so thank you all. I think there are still some snacks you can grab on the way, and make sure we get to the buses to enjoy the fantastic social event, as it always is, courtesy of our wonderful hosts, FHIRly. Thank you.